Level 1. No names. You work as an underground surgical specialist. Your expertise is precise organ removal and transplantation. Very few people can do the work as cleanly as you can. You don't ask why. You don't ask who. Every patient arrives already declared dead. No family, no visitors, no unnecessary conversation. You perform the procedure, you get paid, then you leave. Every patient is identified by a number. No name, no complete medical history, no normal hospital record. Then you notice something else. Every operation takes place after midnight, and the payment always arrives before the patient does. At first, you don't think much of it, but one night, a payment notification appears on your screen. The patient hasn't even arrived yet. You look at the screen, then at the empty operating room, and for the first time, a question occurs to you. If the payment arrives before the patient, who is sending the money? Level 2. Patient 0. Monday night, just after midnight, the first patient of the week arrives. 2 people bring him in on a stretcher. You look at the chart, brain dead. The paperwork appears legitimate. Required signatures, medical clearance, everything is complete. You put on your gloves. The room is silent. You begin the procedure. Your hands are steady. Your movements are precise, the same as always. But something doesn't fit. The patient's body looks completely normal. No visible trauma, no obvious injury, nothing that explains why this procedure needs to happen so quickly. You pause for a moment, then look at the chart again. Where the patient's name should be, there is only a number. You look lower. Medical history, partially blank. Emergency contact, blank. Next of kin, blank. You keep looking at the empty space where a person's name should be, and something becomes clear. You have never been allowed to know the name of a single patient. Every time, there is a number, a body, and one expectation: operate. You finish the procedure. The room becomes quiet again. You remove your gloves. Before leaving, you look at the chart one more time. The same number, no name. For the first time, you consider that the problem may not be that nobody tells you anything about these patients. The problem may be that you're not supposed to know anything about them. Level 3. They don't exist. After that, you start doing something different. You observe the patients, the paperwork, and the people who take the bodies away after each operation. Within a few days, you notice a pattern. Every patient arrives at night, already declared dead. No name, no family, incomplete records. The procedure is completed, the payment arrives, and shortly afterward, the body disappears. One night, you access the hospital's old database. You enter the number from one of the patients. You search. Nothing. You check the number again. It's correct. You search again. Still nothing. You try another patient number. Nothing. Then a third. Nothing. 3 patients, 3 numbers, no records. You leave the hospital database and check government records. The result is the same. Nothing. That's when you realize something more disturbing. These people aren't simply anonymous. They don't officially exist. Not in the hospital. Not in government records. Nowhere. You're not just performing illegal operations. You're operating on people who have been removed from the records of the world. And one question becomes difficult to ignore. Who decided they shouldn't exist? Level 4. What you told yourself. 2 years earlier, your life was different. You had a reputation in the hospital. People referred cases to you because they trusted your work. Then one night, you drove while intoxicated. There was an accident. You lost your license, and your career with it. After that, the bills kept coming. The debt kept growing. You kept applying to hospitals. The answer was always the same: no. For 2 years. Then, one day, an unknown number contacted you. Surgical work available. The payment was several times more than what you used to make. You didn't ask many questions, because knowing the answers might have given you a reason to say no. So you told yourself, they're already dead. I'm not killing anyone. I'm just doing the surgery. And one more thing, maybe these organs are saving someone's life. The truth was, you weren't trying to convince them. You were trying to convince yourself. Then another payment arrived, almost twice the usual amount. No explanation, just one message. We need you again. You stared at the screen, then deleted the message, as if nothing had happened. Level 5. No way out. At first, the money was important. Then, It became normal. You started using it to pay your bills, to clear your debt, and eventually you realized something you hadn't wanted to admit. You couldn't go back without it. Then things began to change. The operations became more frequent, once a week, then twice, sometimes 3 times. The messages changed too. Be ready. Don't be late. Don't ask questions. One night, you finally ask, "Where do the organs go?" The answer is simple. Transplant patients. You ask for proof. No answer. You ask for a name. No answer. Then you ask, "What happens if I stop?" This time, there is no response. A few seconds later, your phone vibrates. There's a photograph on the screen. Your apartment, taken from outside. Tonight. You stare at it for several seconds. Then you understand. This is no longer a job. You're trapped. You think about refusing. Then another message appears. You already know what happens when people stop halfway through. You don't respond. You simply look at the time of your next operation. Level 6. Wrong date. You start checking the records in secret. This time, for yourself. A few days later, you find a transplant record. Everything looks legitimate. A name, a hospital, a transplant date, a complete medical record. For the first time, you consider the possibility that they were telling the truth. Maybe the organs really were going to patients who needed them. Then you look at the date. Your operation, Thursday. The recipient received the transplant, Tuesday, 2 days earlier. You lean closer to the screen. The organ was already there, before you had even performed the operation. You check the donor code, the same code. You open your surgical record again. Same code. You check another recipient. The same problem. You check a third. Same date. Another record. Again, the same contradiction. At this point, it no longer looks like an error. If these records are real, the organs couldn't have come from your operations. And if they didn't, then what exactly have you been told all this time? One question becomes impossible to ignore. If the organs aren't going to those patients, where are they actually going? Before you can find out, your next patient arrives. You look toward the operating table, then at his face, and you recognize him. Level 7. The face you know. The man on the operating table is someone from your past. 2 years ago, you hit him with your car. You had been driving while intoxicated. There was an accident. He survived, but he never regained consciousness. That accident cost you your license, your career, and the next 2 years of your life. You were told he remained in a coma. You never saw him again, until now. You look at the chart. It says, brain dead. The declaration date, today. You look away from the screen, then back at his face. The same face, the same scar, the same man. Your phone vibrates. There's a message. Begin. You look at the operating table, then at the phone, then back at the patient. This doesn't feel random. It feels planned. Maybe they didn't find you after the accident. Maybe they already knew who you were. Maybe they already knew what happened 2 years ago. And now one thought becomes difficult to ignore. Did this patient find his way to you? Or were you brought to him? The surgical tray is waiting. You've performed this operation countless times. Your hand moves toward the scalpel. You tell yourself, he's already dead. The same words you've used to justify this work for 2 years. If you pick up the scalpel, everything continues. The payment, the silence, the next patient, and you go home. But if you stop, the network will know, and you may never leave this place. Your fingers tighten around the scalpel. The patient remains still. The monitor continues. You lift the scalpel. For 2 years, you thought you were running from the biggest mistake of your life. You never realized someone else had been waiting for the next part of it.